So I guess specifically with my role in the clinic, I actually have a lot of direct patient interactions, so I don't actually ever fill any pills or do anything like that. So I'm in the clinic a couple of days a week, and generally what I'll do is that if for example, Dr. Apperson wanted to start a patient on a new medication, she'll see the patient and then she would come out and let me know about the patient and what medication she wanted to start them on. And then I actually would go in and I do things like patient education, so medication counseling with the patient there in the office. And then also for a lot of these medications, they require different paperwork to be completed with the patient. So I'll help with that process. And then working with my technician, we'll work on the prior authorization process to get the medication approved and any appeals or anything like that that needs to be done to get it approved for the insurance. Generally, from what I was taught in pharmacy school and what I've seen in practice, if a patient's aware of the side effects prior to starting the medication, then they're less likely to discontinue the medication due to the side effects. So I do sit down with the patient and I go through all the different side effects. And generally when I'm there on the spot, if there's a simple treatment for those side effects, I'll discuss it with the patient. And then also I have my own pharmacy line, so I'll give that information to the patient as well and let them know that if they have any side effects or any issues, to certainly give me a call and that I can help them manage that. And then I've also started now to try and reach out to patients by phone a week or so after they start the medication to make sure things are going well and make sure they aren't having any side effects or any issues, because my main goal is I want the patients to be adherent to their medication and to be able to tolerate it. So I like to make them aware of what can happen and be available to help treat any type of side effects. With any of these medications, when they're chronic maintenance ones, I don't know that, shooting for 100% is going to be completely realistic for all patients. But I would say, the adherence is a big issue because, of course, if you're not taking the medication, then it's not going to help to try and, prevent relapses and other issues for these patients. So I certainly try to, push adherence with them if they're having trouble being adherent to the medication. I'll kind of, discuss with them what exactly is going on, and sometimes it's as simple as using a pill box, or if they have a smartphone, being able to set a timer on their phone. And then certainly if the issue is that they just can't tolerate side effects, well then that's a perfect time to be able to address that or see if another therapy would be a better option for them. I think so, because I feel like doing an oral medication for a lot of patients is something that they're more comfortable with. A lot of patients with the injections, they don't feel as comfortable doing it, and for some of the injections, they're ones that are not done every day. So when the patient's doing it 3 times a week, sometimes they'll tell me that they forgot what day they're supposed to take it on, or they'll try and do their own injection based on their own schedule, and sometimes that can lead to adherence issues. So I think, just, having a pill that they just take in the morning when they're having their breakfast or something and then they're able to go on their way, I think can be helpful with adherence. Well, I think for a lot of them, they know that basically I think the main thing is sharing with them what the goals of the medication are, and then, making sure that they are a part of the decision making as far as, what medications they're willing to try, and kind of realizing that this is, a lifelong thing, but I feel that if they understand the goals and the reasoning behind it, then they're more likely to take the medication.